I think we should get started. We have a great session for all of you, and I hope more people are going to be coming in. I'm Bob Listernick, for those who don't know, and we really have a great lineup this afternoon. First, it's a pleasure for me to introduce Dr. Karin Walsh. I'm sure many of you know her. She's been very prominent in the NF field. She's a pediatric neuropsychologist in the Division of Pediatric Neuropsychology and an associate professor of pediatrics and psychiatry at George Washington University School of Medicine and Children's National Health System. She's a neuropsychologist to the Brain Tumor and Neurofibromatosis Institutes at Children's National Hospital, and Dr. Walsh has been a long-standing co-chair of the Neurocognitive Committee of the NF Clinical Trial Consortium and a past chair of the Neurocognitive Committee for RAINS, that I'm sure many of you know about, and the Quality of Life Committee. So she's really involved in NF, and she is the go-to person for any questions in her field about NF. So Karin, thanks so much for coming.
Well, thank you. This is one of my absolute favorite things to do through the year, is to come to this meeting whenever I can. So I'm really honored to be here, as I always am, and I'm always inspired when I leave here and get to meet a lot of new people that I keep connected with through the years. So I really appreciate being invited to be here, and I hope that we have a fun session. I was just telling a little bit of a funny story, is I didn't make up the title to my talk, I think because I took too long to do it after I was asked. So I was like, oh, learning and growing, okay. But this actually gave me a new idea of something to talk about. And one of my goals for this year is to kind of do talks that maybe aren't the typical, aren't the norm, and kind of get us all thinking a little bit differently or about some new things. So hopefully we'll do that together. And I left a lot of time at the end for conversation. So hopefully you're all ready. I sent a couple polls out too in the session that I got a lot of responses to, but if you haven't done it, you can feel free to, and we'll pick up on that as we go. Okay, so I'm going to do a couple old school slides, right, with things that I think pretty much everybody in this audience probably already knows about, but just as a refresher. And this leads us into where I hope is kind of a new way of thinking about things. Certainly in NF1, we've known for some time, and we keep learning more details and more important information about the cognitive challenges that can come with having NF1. In general, 80% of kids with NF1 will have some kind of cognitive difficulty. Intellectual disability is a little bit more prevalent in NF1 than it is in the general population, which is more about 1%. Specific learning disabilities, things like reading, math, and writing disabilities is what I'm referring to there, in 20 to 50% of kids with NF1, and some can have more than one of those as well. We know ADHD is very prevalent in NF1, and now we're learning more over the last few years about autism in NF1. In terms of academics, general academic problems, so this isn't necessarily having a specific disability in reading or dyslexia or math or writing, but just having trouble in school, and this can come from attention and executive function difficulties, but more than 50% of our kids are in school having some kind of challenge, and that's why parents are coming to us and saying, can we help us figure this out? About a third have repeated a grade at some time, and about half receive some kind of special education services. In terms of reading and math disabilities, it's about 20% of kids. We don't know a whole lot about writing disabilities, which is interesting. It just hasn't been studied as much. There are a lot of kids with NF1 for motor reasons that writing is quite difficult, from fatigue or other things. But it can also be more the organization of thoughts to paper that gets in the way. But we really just don't know too much about that at this point. And then there's a couple specifics about males being more likely to have one of these specific learning disabilities, and ADHD and reading disabilities kind of hang together quite frequently. And then finally, just in terms of neuropsychological, which it does overlap with all the things I've already said, but in terms of specifics around executive function, which is a really important set of skills, it's associated with the front part of our brains that develops last. So it's kind of a double-edged sword with executive functions, because since they develop for so long of a period of time, into our early 20s at least, they're susceptible, right, to being disrupted from lots of different things. To me, the flip side of that, and the optimist in me, is like, well, there's opportunity then too to do something about that and build those skills over that period of time. But we know that a lot of kids with NF1 have difficulty with attention, that working memory, which is short-term memory. That's kind of like, I always tell parents, like you're going to the grocery store without a piece of paper, right? And you just have your mental shopping list. That's a working memory, an easy working memory task, or hard for some of us. But that's what we're talking about, and working memory is vital because it's involved in mathematics, it's involved in reading comprehension. You can imagine when you're reading, you kind of have to keep some information in your head as you read to comprehend what it's all about, right? So if working memory is hard, you kind of lose track. Kids will say they do a lot of rereading. You know, it's just a lot more effort for them. Planning, organization, flexibility is a big one, and just kind of monitoring and managing yourself and your stuff. These are pretty common problems. I see a lot of head nods going on. The classic, feature in NF1 before we knew much of anything really had to do with this visual spatial processing, right? There was this one test called the judgment of line orientation where you had to really determine a match for some lines, and kids with NF were really bad at that. And that's what we knew to start. That's probably not the biggest problem for most kids, but we do still see that that can be difficult. And that may play out in your regular day, like not knowing where you are in space, how to get to places and navigate spatial areas. Motor functions. This isn't just paper and pencil, but it's also speech. So speech and language, I think there was already a talk on communication, but language and speech are different. They're associated, right? They're about communicating, but speech is the kind of your mouth's ability to move in the ways it needs to pronounce things properly. So we know that, speech can be really disrupted from these motor difficulties as well. Sometimes language itself is as well, in terms of actual communication or vocabulary or knowledge of words, understanding what people are saying. And my last old school slide, and then we're going to move forward, really just has to do with the more social and emotional difficulties that some kids can experience, and adults as well. Again, as we're learning more about autism and what role that might play in social difficulties, social cognition is really part of that. So some of our kiddos do not have autism diagnostically, but they still struggle socially. And a lot of that would be with perspective taking, which I say is also like putting yourself in someone else's shoes, right? Being in an engaged interaction where you're like, I can kind of sense how this person's feeling, and I'm going to take that as feedback to adjust what I'm doing. And so that tends to be a little bit of a hard thing for a lot of our kiddos. Understanding jokes, so sarcasm, social cues, all can be more challenging. Sorry, I keep leaning this way because I can't actually see the whole screen. And then we see actually quite a bit of anxiety, less so I would say with depression, but it can still be a challenge in the children. We see a different pattern in adults, but that's another thing for us to be thinking about. So that's the groundwork for what we're going to talk about. So learning and growth. So I put a poll out there and I said, is learning different than growth? Just what people's opinions are. Now I know my stat is outdated because more people responded, but most people said yes. We think it's over 80%. I think it was the last time more like 85%. Most people think that learning and growth are different things. And that doesn't mean they're totally separate and don't overlap, but that they are unique things. So I thought, let's start with definitions and see if we can think about this a little bit. So if you look up the definition of learning, right, it's the acquisition of knowledge or skills. Makes sense. Think about schoolwork and things like that, or job training, anything. And then growth is becoming greater over a period of time. So again, these aren't mutually exclusive. They're not totally separate from each other, but I think there are some distinct features here. And I'm going to focus on growth because there's a lot out there about growth and what it means and how it can help us, particularly in the face of problems. So when we're thinking about kids and all the things we just talked about that they may experience and families may experience related to NF1, this growth kind of idea, and some of you may be in school systems that have the growth mindset built in, and that's kind of what we're going to talk about a bit today. And I think it really gives us a lot of opportunity for how to have hope, how to have optimism, how to teach our kids that difficulties don't define us, that there's a way beyond that, right? And I think it can be really important in addressing, while we're trying to figure out what interventions could work for some of these things, what things can we do about it, what can the kids and the families do until we get there. So learning, just jumping back a moment, there are a lot of the factors that we talked about already that may impact learning. Again, thinking in the classroom, but this even goes beyond school age. This is even in early life, right? You think about infants, some of how they learn is exploring the environment, crawling around, touching things, putting it in their mouth, right? Feeling things. That's actually a big part of brain development, that experience even in infancy. So you don't have to get to school before things may, be on an altered course in some ways in terms of your brain growing and developing. But we know that, again, the motor challenges can disrupt things for kids in terms of playing on the playground, being involved in sports if they're interested. I hear from a lot of families and kids that they can't keep up physically, so it makes it really hard to engage, again, even just on the playground. The availability for learning can be disrupted, right? Where we're, having trouble staying focused, we're in the classroom, so every few minutes it's like, what's going on? What did the teacher say? And that makes it really hard and really frustrating for kids. Those executive function things, the specific learning difficulties of reading, writing, or math can make learning more difficult. And then social difficulties in terms of social learning. Sometimes we don't talk about that enough, but social learning is important, and that happens on the playground and outside of the school system a lot of times. So I'm going to jump into something kind of neuro, right? So neuroplasticity I brought up because it's important when we're thinking about growth. We're going to talk about what growth can do to the brain, and then this mindset and this different approach to thinking about our difficulties and challenges. Neuroplasticity, though, is the brain's ability to modify. It's pretty cool. This is why, and probably why you're in what you're in, is like, the brain's amazing. And it's why I'm in pediatrics in particular, because the pediatric brain is really amazing and is quite plastic, if you will, or neuroplastic. But it really is the brain's ability to modify and change and adapt to experiences. And that can be an intervention, that can just be a regular life experiences, and it can be positive or negative, right? We actually talk about kids that have early childhoods in poverty. That changes brain development because of the lack of experience sometimes, or the lack of things. But then we also talk about other environments that are very full, and that can change brain development in that way. So you have kind of two types of plasticity, structural and functional, right? So structural is the brain's ability to do things based on memories, or it's the structure of the brain that's changing with memories or experiences. And then functional is more in a disease state, so something like a brain tumor, and the brain's ability to kind of work around and kind of make adjustments based on this disease or something. It could be an injury, et cetera. So there's two types of ways that plasticity is going to kind of be happening. When we talk about it developmentally, we're talking about what I was just saying in terms of experience as a human, right? That can go in both directions. But when we experience things that are positive, well, actually, or negative, there's a strengthening of these connections, right? We have all these neurons in our brain, and how things work is that they start talking to each other. So little tiny babies don't have all these connections, and then they have a lot of connections, and then what happens is we call it pruning, right? So we get the connections right, and we get them to be really efficient, and that comes with experience and time. And that's what we want, right? We want these connections to be the really good ones, and we want to get rid of ones we don't need, and this is what the brain is capable of. And these occur, again, based on experience in different ways. So this is just a quick one, but as you can see, right, we start with not much of a brain before we're born, but over this time into adulthood, the brain has a lot of opportunity to form and make connections and prune and really refine what it's doing. But then there can be ways that this gets disrupted, right? And I'm talking about this because growth and thinking about it in this way can actually be one of the factors that can alter this development, even at any point in time. There are certainly specific time points where the brain is more plastic or malleable than others, and we call them critical periods, and there's many of them, and they're for different kinds of skills. So, your first kind of critical periods are the things you'd think your sensory ability in infancy, hearing and seeing, the motor system, and then you think about 2-year-olds starting to learn to talk and understand what you're saying. Those are all some of the earlier periods of development that is very rapid. And then the more cognitive, the complex things like executive function, attention, those come later, right? The big growth periods for those. And it makes sense. You don't expect a 1-year-old to be very focused for very long, right? And you do expect a 12-year-old to be able to focus for some time, generally speaking. So now shifting into this idea about the growth mindset. So Carol Dweck is a psychologist that quite a few years ago now, really, she was studying what allows people to overcome difficulties, right? And she really developed this theory and idea about what she called the growth mindset. And how she defined it is sort of your passion for stretching outside of the boundaries that you kind of set, right, or that are set on you. So really sticking with something even though it's uncomfortable or it's difficult. And that by doing that, you sort of learn a way to keep moving and to keep striving. And then what comes from that is this growth concept, right? That despite challenges, so we're not saying you don't have them, but despite those, you keep moving forward. And we talk about this a lot actually in kids with anxiety. You know, when you treat somebody with anxiety, your goal in treatment is not, let's figure out how to get rid of your anxiety. Our goal in treatment is often, let's figure out how to help you live your life with anxiety. And actually it helps your anxiety when you've found a way to acknowledge it, accept it, and then still keep moving forward despite it. So it's a similar idea, but just in broader context from Carol. Okay, I don't know. That's not too bad, how big it was there. So there's the counterpart to a growth mindset is a fixed mindset. And when you hear fixed, you think inflexible, right? And we already talked about sometimes in NF, flexibility is a hard thing. And so let's talk a little bit about the differences. So in a fixed mindset, you know, here are some of the cognitive thoughts, the things that people sort of say to themselves. My failure is because I'm not able, I don't have the ability to do this. You know, I'm either good at this or I'm not, right? You're saying this is very black and white. It's like there's no middle ground, there's no gray to work with, which is pretty limiting, right? I fail or I'm the best, right? I don't like to be challenged. My potential is already determined. If I can't do that, I just can't do it. That's how I was born. That's who I am. Pretty limiting. I give up when I get frustrated. If you give me feedback, I feel like it's very personal. I take it as a criticism, not an opportunity for maybe I could do this some other way, right? And I stick to what I know. So you may have people, you yourself might feel like this is how you sort of see the world. It's not just an NF thing. There's lots of people in the world that really tend to see things as black and white, dichotomous, and it does limit people. So the idea is, can we move into and teach folks how to have this greater flexibility, to see that there's gray, because most of the world is actually in the gray area. So the growth mindset, people that kind of have that tendency will do things like, that failure is actually an opportunity for me. Maybe this can be better next time because that didn't go so well. I can learn anything I want to. And that doesn't mean I'm going to learn it like Joe. I might learn it my own way, but I can learn it and I can get there. And I'm always telling my trainees, like, there's a lot of pathways to an endpoint, not just one. And so give yourself that ability to take your own path. Challenges help me grow, right? How I approach something helps me succeed or fail. Feedback is constructive. When somebody has something to say, that gives me an opportunity to kind of think about it differently, do it differently, approach it differently next time. And I like to try new things, or I'm inspired by the success of others. I think a lot of people in this room are at this meeting for exactly that kind of idea. You're inspired by people around you and how they're doing things, and we learn from that. So these are kind of two counterbalanced approaches to life, I guess, or views of life. So in thinking about kids in general with different disabilities, and specific in our NF population, the things we talked about our struggle, you know, these children want to do well. And I always say, again, in my office, I could count on one hand probably the kids I've met that really don't care about doing okay, probably less than one hand, frankly. They just get stuck. There's just like, again, and if you're a bit more in this fixed mindset, it's like, I can't do that. So where do we go from here? You know, that's it. And then of course that can become behavioral, emotional in terms of its output, because kids are frustrated. They don't know how to solve it. They don't know where to go from here. And so I think by us understanding that fixed mindset and why that might produce certain things, that can help us as the adults in the room. And I know this is easier said than done, but help us like, okay, maybe there's something I can do in this moment to bring down the emotional, kind of the high emotions, kind of start thinking together about a flexible approach to this. But you can see a lot of behaviors that come from feeling overwhelmed emotionally, because it is important to these kids to do well. They want to, they work harder than most already, by the way, as you all in this room, I'm sure know. And then there's more of a tendency to have that fixed or negative mindset for a lot of kids that have different struggles, because usually inadvertently, but it happens, they get a lot of messaging around that, right? I see plenty of kids with ADHD who've heard a million times, like, you're just being lazy, you're not putting the effort in, maybe you don't care about your grade in this class, because that also comes from frustration of the adults, like, I don't know how to help you, but we're all stuck. But so they take that in, right? And then they start really believing that and seeing the world a bit more in that negative way. But we can change that. So it's not, we didn't ruin anything if we're there. And then there's a lot of rigidity around, a diagnosis too, kind of things that, again, just sort of seem to come with, or people talk about, that aren't helpful from the standpoint of a growth mindset. So a couple quick, this isn't all the studies, there's a ton of research out there, but a couple quick examples of how different programs really focused on teaching kids this flexibility and this kind of this growth idea. They've done a couple studies with mathematics. So before and after intervention, you have two groups. One group just did their regular thing, took a couple exams, and you can see that's the orange line there, that their GPA in math probably is about the same, maybe a little lower over the year. And then they took another group and they really did this growth mindset, which we'll talk about some strategies, but it was things like, okay, yeah, you didn't get it this time, or you didn't get it yet. Yet is a real key word in growth mindset. It's like, all right, that was your try then. We got places to go still with this. And so really worked on a lot of this, again, flexibility and thinking, or that was an opportunity to learn about what didn't go well that time. And those kids actually improved their GPA over that period of time. And then another one, this was not math, but more just general, like a problem-solving task. So this was the link between the mindset and how persistent kids were at something that was hard for them. So the green line is the group that got effort praise, and we're going to talk about that in a bit. And the other group got intelligence praise. So I'll kind of preview where we're going with this. But effort praise is like, I like how you worked on that. I like how hard you worked on that. I like that you were really careful and thoughtful before you answered. Intelligence praise is, you're really smart. That was awesome. You got a straight, A+, right? Good job. So again, that's not going to help us in terms of flexible thinking. And so this type of mindset really does empower children with disabilities. I think we all can fall into a tendency we want to be helpful and we want to support our children, and I want to support my patients. And so it's easy to go like, I'll do that for you, right? Let me help you. Oh, that's not quite right. I'll do it. I'll fix it. But when we can get into this growth mindset and our feedback is like, I like what you did there, and next time we can maybe try this too. That's very empowering for a kid. They like to allow that mistake or allow that rough patch of getting through something, whether it's academic or not, and then figuring it out is super empowering. And what we always are trying to do with the kids in my office is I want them to go live adult independent lives, right? And they have to be empowered. They have to believe in themselves to be able to go live that life. So this kind of an approach to life does help them realize, like, I can actually manage the problem. It's a problem, but I can do something with this. So by teaching them this, it really does help them feel that way and believe in themselves. It increases communication with words instead of behaviors, especially in our younger kids, as we were talking about, frustration. Another thing I'm always saying in the office is behavior is communication for a lot of kids. And it's our job to figure out, like, what are you trying to say right now, And sometimes it's easy to figure out, and sometimes it's not easy at all to figure out what it means. But when we can, again, then there's opportunity for other ways. And giving this kind of approach, again, you get less frustration, less emotionality, less behaviors, and increasing confidence in self-advocacy and independence, of course. So what ways can we foster this, right? How can we do it? So it can be simple things. And I know as parents, it's like, oh my gosh, you're telling everybody else to do one more thing. It's so hard to keep up with all this. But I think it's just about this big concept and then even just plugging little pieces in. It doesn't have to be this massive change. And many of you are probably already doing a lot of this, frankly, and maybe there's just little tweaks you want to add to it. But you can ask your kids questions like, through their day, what did you do that made you think hard today? So like, what went wrong today? No, what would you do that made you think hard or was hard? Things like, what new strategy did you try with that, kicking the soccer ball, learning to read, doing the math problems? What mistakes did you make that taught you something? So when we say that, like if somebody says that to me, it's like, oh, you're kind of what I'm getting there is like a mistake's okay because you're acknowledging that I might have made one. So it sounds like that's not a terrible thing. Oh, and that maybe it taught me something. That's a cool concept, right? That's a good idea. That's an interesting idea. And so those are just, a couple questions. You can think of a million that are sort of like that. And I have some resources at the end for you guys. There's a ton out there on really supporting this kind of approach. Rewarding the process, changing our language, and modeling growth mindset are other ways that we can go about helping our kids and families. So this I already sort of got at a little bit, is rewarding the process, praising the effort, work strategies, mistakes that they learn from, improvements that they've made, even if they're really tiny, but not things like grades, test scores, right answers. And we do this in testing too, because not every kid loves, by the way, a day-long neuropsych testing. So sometimes we need some strategies for really keeping it going. But this is what we do. We're like, I really like the way you're approaching that. I really like how you're thinking about that. I like how you stopped before you answered because you were going to go for it, but you really held back. And so I'm reinforcing what I want more of, which is I like how you're working. I like what you're doing. I'm not saying that answer was right. Oh, that answer was wrong, right? I'm not doing that. That would be very annoying and also would not really get a kid too motivated to keep going, especially since our tests are made to eventually get to things that you can't do. And so the more we praise effort, the more the kids will be like, I'm going to keep going. I didn't get it right, but you've given me the messaging that that's not the end point, that that's maybe a start point, right? So it really helps them feel more motivated about their strategies and their persistence in a task. So these are things that actually like people that are a bit more fixed might be saying to themselves on the left, but we can also change this up about what we might respond if our child or somebody we know says this, like, oh, I failed that test. We could help them, but like, well, maybe you just haven't mastered it yet, right? There's the yet word. It's always like yet is a good kind of thing to keep a door open. I can't do that. Well, maybe you just need a different strategy, but you can do hard things and I'm here to help you, right? I can help you think of some new ways to maybe approach this. Giving up, that's obviously something that we face a lot, is I'm not going to do that. That's too hard. I'm not even going to try that. And we want to encourage kids to say, I could use a little bit of help figuring this out. I don't really know how to approach this. And again, I think for a lot of our kids with NF, that getting started is quite hard. So it doesn't mean they can't do it. They absolutely can do it, but you've got to give that little like at the beginning. And I think it's hard, especially as kids get older, and you hear a lot from school personnel sometimes is, well, your child is 14 years old. I don't see why they can't do this on their own. And it's that expectation that's set. And it's like, that might not be where that child is. So it's really hard, but it's important that we're educating others. And I think even as parents and others, sometimes we have this expectation and really want our kid to be able to do that on their own. I think, but just understanding, because once we get kids started, often they're good to go. They complete the task just fine, or sometimes even better than fine, better than their peers. And then modeling. Now this will feel really awkward and weird because what you're supposed to do is talk about yourself problem solving through the day and giving your models to your kids. So you have to really kind of think about doing it, but you do it all the time. I mean, parents in this room are quite resilient. So you're doing all this stuff probably quite frequently. So now it's just outward verbalizing it. So your kid can go, oh, my mom or my dad doesn't have it all together all the time either. And then I'm watching them work through this problem and not make it that stop sign, but sort of more of like, let's figure this out. So having a mistake happen, modeling through it, exposing them to healthy risks. I just took my sons here with me at this meeting because I wanted to see all the wonderful things that happen here. And I like to regularly push him outside of his comfort zone, half to get on his nerves and half because I want him to be an independent adult one day. And he didn't want to go on the boat and I made him go and he loved it. So, but you know, these healthy risks, again, we're not shoving kids into things that terrify them, but just that little extra step over where their boundary would be. Because once they get over that, again, it's like, oh, that was actually pretty cool. Or, oh man, I did it. And I really actually enjoyed it. So it allows you to think about the next step outside of your boundary, right? Encouraging asking for help. And again, I know some settings don't really encourage that as much, but we can, as much as possible, like, I want you to ask for my help. It's fine to ask for help, right? That's what we're here for. But that's a hard one for kids as they get older too. Teenagers, of course, do not want to ask for help at all. So we may not ever solve that problem. But, and again, using your own kind of self-talk as you're going through something like that's hard, talking about how you're solving that problem or moving through it. So, you know, I talked about brain plasticity at the beginning, and really this growth mindset is all about that. It's a positive way of making new connections. And there's definitely studies out that show a number of things that we can do that actually, when they do imaging of the brain, show that there are new connections, there are better connections from this kind of experience. Now, it takes time. You have to have some patience as with everything else. You know, this won't happen in a week, maybe even a year, but just laying this foundation and trying to, as consistently as possible, kind of approach life in this way. The kids, like everything else we're doing to help them, whether it's a reading intervention or something else, the idea is that we're teaching strategies that then when they are on their own, they're like, oh, I kind of remember that thing that my mom taught me about, or my dad showed me, or my teacher showed me, and I'm going to go ahead and give it a try, even though I'm by myself right now, and sort of taking those risks and integrating that more into their own mindset and their own approach to moving forward. So there are a bunch of things out. I gave a couple, there's a couple of things here that are good ones, like Class Dojo has some videos about growth mindset. The Big Life Journal has a gazillion and million gazillion resources and printables and all kinds of stuff. So that's a really good place to start if you're just looking for, like, how do I integrate this into our daily life a bit more? But there's workbooks for kids, there's books for teenagers, all kind of, like, really, if you just put growth mindset in the internet, you can spend days probably sorting through. But these are some particularly good ones that you could start with. So I left a lot of time on purpose because I like talking to you guys more than I like talking to you guys. I know there were some questions in, but I want to do one quick thing, because I talked to you about the question I put out about whether you thought learning and growth were different or the same, which we could definitely talk some more about that. But I also put out what was going to be a word cloud, except I don't know how to share anything that comes out of here. So I should have brought my glasses. But I thought there were a lot of cool words in here that you guys put up, thinking about what words support growth, right? A lot of people put in their failure, which sounds like what? But I think that's right? It's about failure not as something bad, but as an opportunity for learning. And I think then that sort of says, like, there are people that understand that failing is important, right? We all fail, we all have to fail. There's nobody that doesn't fail at some point in time. It's all what you're going to do with that moment or that failure that really matters. I don't know if you can see this better than I can, but more words came through, so it made it really small.
They're small.
But development is in here that actually popped up bigger. I see resilience, right? And that's exactly, I think this growth mindset is about being resilient.
Can you read them? Independence, faith, confidence, enlightenment, empathy, acceptance, lots of great words.
Yeah, I think there are amazing ways to think about this. And I love that everybody had different ways that they sort of think about this concept of growth. So thank you, by the way, for doing the poll. I thought the app was super fun.
Dr. Walsh, truly an eye-opening talk. Thanks so much.
Thank you.
We have a lot of time for questions. There are some on Whova, and then we'll take questions live from the room if you'd rather just talk. I'll start off with at least one of the Whova questions.
Yeah.
How common is emotional immaturity in children with NF1?
Yeah, I think that's a good one. I think a lot of people will describe kids with NF1 as seeming less mature than their peers, and that can be for a lot of reasons, though. And I guess when we're talking about emotional immaturity, we're talking about emotional development, and are they on that typical curve, right? Every skill set we have has a generally standard or typical developmental curve, and we'll talk about how kids may fall off of that or be off of that curve. So I think that that does happen fairly frequently for a lot of the kids that have ADHD in particular, and that's actually true outside of NF1, that kids with ADHD tend to maybe seem or be a bit less mature in certain ways. I think how that plays out often is like the inability to inhibit impulses, right? So you're thinking, well, you're too close and now you're 12 and you should kind of know that people need space, although maybe COVID's helped that, I don't know. But, so I think they seem immature and just not reading situations maybe the same as peers who don't have ADHD or NF1. So, and then I think that if kids with autism can also seem a bit less mature or may seem more mature in some ways, actually, depending on how that manifests in a particular child. Because some kids, their interest areas that are very specific are very adult-like interests, so they
very
can
much
come
so.
across as way more mature in a certain way than their peers. So I do think it's fairly common, but the reason why can be different. Or again, if it's a speech-related problem, a child may seem immature because their pronunciation sounds more like a younger child. So it may not even be really a cognitive thing as much as it is how you're presenting rhetorically or speech-wise. That's a good question, though.
It is a good question. I have other questions in Hoover, but please, if you have questions that you'd rather come up to the mic for, I'll ask the monitor to just grab a mic and walk around so everybody can hear you. But I'll start with the next one. But if you have a question, raise your hand and we'll get you a mic.
Or also just comments or your own experience with this, honestly.
Absolutely.
I mean, anything.
Absolutely,
anything.
any comment. I'm going to ask one more. Go on, sir. Ask your question. I don't know if there are any mics out there. Let me make sure it's turned on for you. Hello. It's not on. Oh, now it's on. There you go.
Take your time.
Come off.
It's okay, but put it back before I answer so you know what I say.
The importance of your presentation cannot be underestimated. I think, though, you're leaving out today, I hope not permanently, adults with NF who have these problems and had these problems and were not well diagnosed or treated.
Yeah.
Let me add to that.
Yeah.
I got a text about a question. Can you use growth mindset in adults?
Yes. And you're right. And that is, you are exactly right. And I apologize for that. I'm a pediatric person. That doesn't mean I can't speak to other things, though. But it is my comfort zone to talk about kids because those are the kids. I see the kids. But you're absolutely right. Many of these things are not age specific, right? Now, maybe if we're talking about, some of the school-based kinds of challenges, maybe that's a little different. But that might happen in your workplace instead of the school setting.
There's a lack or seeming lack of resources for adults to have access to the type of psychological testing that would help with defining and diagnosing learning disabilities in adults, and perhaps that's something, no, not perhaps, it should be approached by the CTF to make those resources available.
Sign me up
And
to help,
all right,
because I agree.
I could go on and on, but I'm not going to. But also, a lot of the problems that are discussed with learning disabilities and the way they appear to outsiders and to the person, things that might be wrongly diagnosed as psychiatric problems with anxiety and depression, instead are learning disability problems. And if those were focused on, people could stop wasting time thinking, I have a psychiatric disability that's crippling to me and I have to spend lots of time in therapy for it, when instead these are things that could be approached as learning disabilities and find ways to work around the problems instead of suffering from what you think is a neurotic disability.
Yeah, and I think your
Thank
big,
you.
Yeah, of course. Thank you for your comments. I think your big messages in adults and beyond, we're really lacking comprehensive diagnostic assessment. Like what we do in kids is exactly what you're looking for. Figure it out, right? Is this anxiety or ADHD or what is it? That's what I do every day. I love that. It's like a puzzle. That's why I like it. But you're exactly right. Now there can be resources. I think what you're also speaking to is nobody knows how to get them. Right, so there can be providers in the community and at adult-based hospitals. Again, I'm in a totally pediatric hospital, so, but there are hospitals that are, Hopkins and other places, at least where I live, that, it's birth to death care. So, and there are adult neuropsychologists and adult clinicians that can do this kind of testing. So it sounds like part of it is nobody knows where to go to find that out.
Yeah, I
And
think-
maybe that's a CTF thing that we can
I
devise a
think it
list
should be,
of,
I agree, it should be a CTF
resource.
thing.
I
Yeah,
think it's a great
I'll just
idea.
mention a corollary to that. As a pediatrician, I hear it all the time. People think that ADHD or ADD stops when you're 18 years old. But that, and that you don't need medication for it. That's absolutely not true. And, if your kids have ADHD and they're on medication and it's life altering as it is for many kids, they're probably going to need it into adulthood as well. So just keep that in mind.
Yeah, and the thing that goes along with that very closely are those executive dysfunctions. So even if your attention and your impulse control gets better with age, which it often can, the executive dysfunction stuff, it doesn't go anywhere, right? And as an adult, it may impact you even more because a job setting, higher education, whatever you're doing, the demands for executive function. This is why we see kids like going into middle school, going into high school, because things start to fall apart a little bit if you have these executive difficulties, because the demands keep increasing at a pace that sometimes their development is not keeping up with. So these are all very relevant to adult life. And I do agree with you completely that we're lacking attention in those areas. Listen, nobody's looking at all that I know of in aging in NF1.
That's true.
We know nothing. So we've got a lot of work to do.
Speaking about ADHD, and can I ask you just to have them take a mic in case somebody in the audience wants? Thank you. I'll say the next question. I'm waiting for my 8-year-old son to be diagnosed with ADHD, but I have no doubts. As an ADHD mom in burnout, it is exhausting keeping up with his frenetic need for engagement. And I fear I'm creating in him the same RSD and anxiety I have from growing up constantly corrected for being just me. How do I balance staying loving and responsive to him with my need to keep from being overstimulated?
Yeah, this is really important. I mean, parent burnout, whether it's ADHD, any of the things we've talked about or a combination of those things is really hard work. And I think people have a lot of guilt about that because you don't want to feel like it's hard to be somebody's parent. But it's okay. We talk a lot about acknowledging that difficulty. And once you acknowledge that, it gives you some freedom from that guilt too. But I think the things we talked about today can be very relevant to that in terms of, as a family, maybe you do some things around this more flexible mindset that might be helpful in terms of addressing this constant need. Essentially for a lot of parents of kids with ADHD, your own frontal lobes and theirs, and it's very exhausting sometimes. It's a lot. And I think having some kind of respite, right? It's okay to get away. You have to get away. And I think that a lot of this, we have healthy ideas about taking breaks, getting out. I literally assign parents on dates and stuff when they come to my office because I'm like, when's the last time you guys went and did something without everybody? Nobody can remember. I'm like, that's your assignment. You have to go out to get a babysitter, do whatever you need. Or if you need more professional respite care, like if your child really does struggle behaviorally or it's more, more intense, there are organizations that can provide respite care. So if your neighbor's not going to cut it, the teenage neighbor isn't going to be able to handle it, that's okay. There's other resources. And I think you can get back to your NF teams and say, hey, I need this. I need some time. I need some support. And I'm a big proponent of support for individuals, whether it's family therapy, individual therapy, to deal with the stressors of, really trying to love and help your kid, which is exactly what you're doing. And, but I acknowledge that it's quite difficult and people are struggle to acknowledge it and talk about it out loud, I think sometimes. So I'm glad you brought it up. And I think probably a lot of people can relate.
I'm going to stick with this theme because this is a question I get a lot. At what age do you start evaluations for ADHD and or autism spectrum disorder?
Whenever you have a concern. If you're concerned at 2 years old, give somebody a call. I really do believe that parents' intuition is a really important tool. And I'd rather you come into my office when your kid's 2 and I go, actually, they're totally like, this is what 2-year-olds look like, for the most part. I'd rather tell you that and send you on your way than you never asked, and there was a thing that we could have maybe figured out that early, because the earlier the better, right? The better, the more we understand kids at an earlier age, no matter what they're coming into the office with, the more we can do in the early phases. And as we had that slide about the critical periods, this brain development, it all matters. Now, I want to counter that with saying anybody that didn't bring their kid in until they were 12 should feel no guilt. Okay, you just do the best you can. You go in the moment that you're in. If you felt like everything was fine until they were 12 and then you were worried, that's okay. So you didn't, I think, again, that's another place of guilt for families, is like, am I too late? It's never too late, in my opinion, ever. So really, there's not an age. Now, generally speaking, most kids don't get diagnosed with ADHD at 2 years old. That's pretty young. And kids that are 2 look like kids with ADHD normally, pretty much like that.
Nobody's putting them on a medication.
No,
just to be
medications
clear.
should not, probably, except maybe a rare circumstance. Now, I have diagnosed a couple kids that are like 3 or 4 with ADHD, but they are pretty extreme situations that really there was not a lot of question. But for the most part, you're going to see the evidence of ADHD as kids get into preschool, kindergarten, because there's, that's when things start pulling apart a little bit for some kids. Some kids, you may not notice the difference until, again, they're going more into the middle school phase. ADHD isn't thought of on a spectrum, but it really is. I mean, you certainly, as a clinician, see cases that you would consider mild, and you see cases that you might consider pretty extreme. No 2 ADHD kids look the same. They might have the same general criteria for a diagnosis, but they're still individual humans, and you have to treat it. That's, for us, treated as such. So I think, again, your intuition, if you have a question, you should ask it.
We have a lot of great questions on Hoover. Here's the next one. Are children with NF more prone to be upset by day-to-day, quote, disappointing experiences, like a toy breaking or granny doesn't come over or something like that?
Yeah, I think that inflexibility is a big one with that, where it's like the expectations are there for the kiddo, like I need it to be this way, or I start to really get either anxious or upset about it. I think they have big emotions. And that can be really hard to navigate, right? But again, I think there's an opportunity for this type of thinking about this flexible mindset and starting to build in and use this language about that. Now, if a kid has autism, then inflexibility can be quite extreme. So, you may need more professional assistance to kind of build that flexibility. But yeah, I would say big emotions are quite common in kids with NF1. And if they have comorbid ADHD, probably even more so, because ADHD, again, by itself can produce a lot of big emotions for kids. A lot of times it's feeling overwhelmed, and not having an approach to the problem.
You have a question? Oh, yes, Danielle.
Thank you, Dr. Walsh. That was a really excellent talk, and just thank you for being here and with us in the community.
Danielle, why don't you take your mask off so people can hear a little even better?
So I'm an NF1 mom, and many of the things that you were talking about today actually made me think of my non-NF kids. So it's got great applicability across like the parenting.
Oh yeah, for sure.
There. But I also appreciate kind of the awareness that you've brought to this topic, and how prevalent some of these issues are in the NF community. And we've heard a bit about kind of that neuropsych evaluation, and kind of thinking of it from a preventative lens. Like our kiddo's pretty young, he's 5, and they wouldn't even do a neuropsych evaluation until he was 5. But like, what are the things that we should be thinking of, as he is now going to be going into school? Yeah. You said, like, if you're concerned about something, get attention for it. But like, broadly speaking, what are the other things that having not gone through the neuropsych program yet, like, is that the catch-all? Like, they'll find everything that we could be thinking of? I mean, that's obviously maybe not realistic, but are there other avenues that we should just have in the back of our mind? If this comes up, this is your resource for that.
Yeah, I mean, I think neuropsych, I'm a little biased, obviously, it's what I do. I do see kids where there's not a major problem yet as our sort of start point. Like, I also see, my non-NF life is in brain tumor, non-NF brain tumor. So, thinking about a baseline eval. Now, again, there's a lot that goes into that, in terms of insurance and all those things. So we won't delve into that whole chaos, but I'm okay with that. I actually think about neuropsych in a different way than maybe some, as a kind of preventative medicine approach, and with different tiers of kinds of assessments. So, anywhere from the traditional Cadillac neuropsych assessment, where we're going to assess pretty much everything that you are capable of as a human, and see where you are on that, to a more focused assessment where it's like, I'm just really worried about attention and everything else seems to be going okay. Then you kind of pare that down and just focus in on those. And I would include risk areas. So if I'm going to see a kid like yours, I'm going to say, well, we don't necessarily need to do like an all-day thing in a 5-year-old, first of all, but maybe I'm going to focus on, early attention, executive functions. Those are going to be just starting to develop in real ways. So we're going to assess it for where it is. All the tests are age-based. So what it allows me to do is perform a test with a child in my office that gets compared to what's called a normative set of data, which is that kid's same age. So then it gives me that reference, like, okay, well, actually, your child looks just like most other 5-year-olds with attention, and right now, not concerned. In cases like things like NF or brain tumors, that's not usually the last time we'll see each other. Sometimes then as things go on, you have a new concern, or you're like, now I'm seeing, or maybe we picked up on a little bit of attention difficulty, but nothing too big, but you're like 2 years later, like, now I'm really seeing the impact of that, now what? So I see that we could provide different level, or screening and consultation. The kids don't have to come in my office every time to help you for me to be helpful, right? I do a lot of consultation with, like, we just saw your kiddo a year ago, let's just check in. And a parent might say, things are going great. Okay, let's check in 6 months or another year and see, or call me anytime. So to me, there's more flexibility. There you go, modeling flexibility in neuropsych. Then I think neuropsychs tend to be real old school, traditional, like, don't like, now we use like iPads for testing. I love it. Now we're doing telemedicine kind of care. I love it. Most neuropsychologists are like, no, we like to use our old paper tests, and we do everything with everybody. But I don't think that's feasible or reasonable for families or for us, frankly. So to me, if you have any concern, and if you have a team that maybe doesn't have somebody who sees younger children, and maybe that's where that came from, there's other, there can be other resources if that's something you really want to have done. It's possible. I hope I answered your question.
No, that was great. Now here's something I was talking to somebody about last night. What are the signs to look for a child that may have ADHD, ADD, or anxiety? My son bites his nails badly, has anger outbursts, doesn't eat when nervous, and can't sit still. What are the steps as parents to help your child? How to handle it? I want to have a growth mindset and teach him right.
Yeah.
Thought somebody.
Yeah, yay. To me, that's a case that an assessment can be very helpful. Anxiety and ADHD can overlap a lot, and you can have a kid that has just anxiety that looks like ADHD, because the truth is anxiety in kids is very internalized. Well, it isn't all people, but it's an internalized process, so it's not always obvious. ADHD tends to be more externalizing, but the symptoms can overlap and look the same. So sometimes it's very hard to differentiate whether somebody has anxiety, ADHD, or both, and they can occur together. And so, if it's a case where it's both, it's complex, but the treatment and the approach to helping would be different if it's anxiety or ADHD. So it's actually, to me, quite important to sort that out. And again, anxiety behaviors can look pretty extreme at times. If somebody has really bad anxiety, and it doesn't always make any sense to us as observers. And I will spare you a personal story on that from my family, but one of my own kids took me a while to figure out it was anxiety.
Ditto.
We had a lot of issues with socks for a while. And I was like, what is even happening here? And I'm a psychologist, by the way, everybody. So just so you know, parenting, it doesn't matter what you do in your professional life.
I think I'll do one or maybe two more questions. Oh, is there one there? Where? I'm sorry, I can't see you.
Hi.
You talking to a mic? Thank you. I can't.
Can you see me?
Right in my eyes.
I also want to thank you very much for this talk, because it's something that we have dealt with for years. I'm an NF mom as well. And I guess my question I wanted to ask you is, she makes straight A's. Scholastically, she's above average, but this social part is so hard to get other people to understand.
Yeah.
The inability to read another child's expression, respond appropriately. It's something that I don't have to teach my other child, and so I don't know how to teach it. A lot of it comes naturally, and I think you feel I feel very inadequate in that. But I guess my biggest question to ask you is, I think IEPs are becoming more norm for children with ADHD, which we also are dealing with. Is there anything that you recommend on an IEP for an NF1 child with ADHD, since it's so common, that would be beneficial for this growth mindset or helping them learn?
Yeah, I mean, IEPs are tricky because I guess a couple things that I think about with it. One is we're working it with institutionally in two different ways, right? I think as parents and clinicians, we are we're trying to operate in preventative ways, right? We're like, I'm noticing something. I'm not trying to wait till this explodes in our faces. What can we do? And I think school systems in general are certainly more reactive systems, right? Like, well, until you fail, not sure we're going to be able to really be helpful yet, right? Like, we've got to wait till this failure happens. To me, I hate it, but we have to work sort of in these systems that we have. So we try to make the best of it. I think from that ADHD standpoint, an IEP is going to plug in the regular old stuff, like extra time, preferential seating, maybe we get repetition. That might be perfect for some kids. That might be really what fits, but there could be other things that don't. And when it comes to growth mindset, my kids were fortunate to go to a school that really incorporated this in. And they did a lot of, I think a curriculum can be built for kids to really be focusing on effort, even though it's very hard because everything's grade-based, right? That you can't totally get away from that from, again, the school perspective. But I think you absolutely can build curriculum. And there's a ton of stuff that's for the educational setting with growth mindset, because it has been a big push in education for a number of years now. So we can connect, and I can try to get some resources for you too that's more specific to an IEP and what kinds of specific things can be built into that around focusing on this approach to dealing with ADHD or other things, even the social piece, right? And we're looking for small wins, right? We're looking for, I really liked how you did X, Y, or Z in that moment. And that, so it can be applied to really anything. I know that's an incomplete answer for you.
I know we can keep going on and on.
I would like to hang out with you guys for like 6 more hours.
It was a privilege having you here today, Karin.
Oh, thank you.
so
Thank
much
you. Thank you guys for
that.
coming.